Hello, today I want to show you my case presentation which the title is Jaundice in Early Infancy. My name Muhammad Shamli Muhammad Johari, Medical Laboratory Technology from University Selangor. What is the aim? The aim is to learn about jaundice in newborns and about hyperbilirubinemia, to learn about the signs and symptoms of this disease. Next is to know what is the laboratory diagnosis, and lastly to understand the recommended treatment for this disease. Learning outcome. First, introduction. Second is case presentation. Third is discussion, and lastly is conclusion. Introduction. Jaundice is a common physiologic problem seen in both term and preterm newborn. Normal transitional change in bilirubin may lead to physiological jaundice in many newborns. In some newborns, this normal change at birth may be exaggerated, such as occur with immaturity or may interact with health alteration, result in the accumulation of development of hyperbilirubinemia. What is hyperbilirubinemia? Hyperbilirubinemia is condition in which there is an excessive percentage of bilirubin in the blood. As stated previously, bilirubin is a product of the red blood cell breakdown. However, newborns are not easily able to excrete it, and it usually builds up in the blood and other tissue and fluid. Generally, before birth, the placenta removes the bilirubin from infant, being in process by the mother liver. Still, jaundice is normal in newborn baby due to the immaturity of the liver, which cannot effectively metabolize and excrete the bilirubin into the urine and feces. Case presentation. Newborn delivered of labor room last 19 September in Avicenna Specialty Hospital. Observed to gestational age with 39 weeks. A live full-term male newborn. A day of life. Maternal history. 30 years old, no background hepatitis with negative VDRL and non-reactive HIV 1 and 2. The blood group is O positive and no background of chronic or metabolic disease, cardiac complication or respiratory problem. After being born, some tests have been done, such as blood group, thyroid stimulating hormone, and G6PD. For blood group, the newborn is A positive. TSH 6.56 and G6PD it is normal. Newborn was admitted at nursery from 19 September until 27 September 2018 because presence of jaundice in the skin and sclera. Next, after that, several tests have been done until newborn is discharged. With 3 tests have been done: direct test, serum bilirubin, and total bilirubin. For direct test is negative, means no any reaction in blood circulation of newborn. For serum bilirubin and total bilirubin, is the number or result continues to rise until 26 September, but 27 is going down. Discussion. According to result of the tests that have been done and symptoms, it is correct to indicate the newborn is exposed to jaundice or hyperbilirubinemia. According to the result, it is too far from normal range. For example, normal range for serum bilirubin is less than 200 umol, and total bilirubin is 205 umol per liter. After 1 week, for total bilirubin is less than 24 umol. Jaundice or hyperbilirubinemia can happen when abio incompatibility with mother and newborn. This can cause hemorrhagic disease of newborn or HDN. However, this incompatibility usually has less serious consequence. It occurs when the mother is type O and the baby is type A, B, or AB, as with RH incompatibility. This means that the mother immune system do not recognize the A or B antigen will see them as foreign substance that trigger an immune response and attack to this newborn because his mother blood group O while his son blood group A positive. Direct contact also know if newborn has immunisation in itself, but from the result, negative mean no reaction of immune in the newborn. What causes hyperbilirubinemia? During pregnancy, the placenta excretes bilirubin. When the baby is born, the baby liver must take over the function. There are several causes of hyperbilirubinemia and jaundice, including the following. First, physiologic jaundice. Physiologic jaundice occurs as a normal response to the baby's limited ability to excrete bilirubin in the first day of life. Second, breast milk jaundice. About 2% breastfeed baby develop jaundice after the first week. It peaks about 2 of age and can persist up to 3 to 20. Third, breastfeeding failure jaundice is caused by failure to initiate breastfeeding, result in dehydration, decreased urine production, and accumulate of bilirubin. Next, jaundice from hemolysis. Jaundice may occur with the breakdown of red blood cells due to hemolytic disease of the newborn, or from having too many red blood cells that break down naturally and release bilirubin. And lastly, jaundice may be related to indicate liver function due to infection or other factors. What are the symptoms of hyperbilirubinemia? The following are the most common symptoms of hyperbilirubinemia. However, each baby may be experience symptoms differently. Symptoms may be include yellow coloring of the baby's skin and eyes. Second, poor feeding and lethargy. What the treatment? Treatment may be include phototherapy, fiber optic blanket, exchange transfusion to replace the baby's damaged blood with fresh blood. Educate hydration with breastfeeding or pump breast milk. Treat any underlying cause of hyperbilirubinemia such as infection. Conclusion. Hyperbilirubinemia is a condition in which there is too much bilirubin in the blood. When red blood cells break down, a substance called bilirubin is formed. Babies are not easily to ever get rid of bilirubin, and it can build up in the blood and other tissues and fluids of baby body. This is called hyperbilirubinemia. This is called hyperbilirubinemia because bilirubin, a pigment or coloring It causes yellowing of baby skin, eye, and other tissue. This called jaundice. Last, low-level bilirubin are not usually concerned. Large amount can circulate to tissue in brain and may cause sclerae and brain damage. While the hyperbilirubinemia cannot be totally prevented, early recognition and treatment are important to preventing bilirubin level from rising to dangerous level. That's all for my guest presentation. Thank you.